So what is that we want to achieve? What is that we want to aim for? Well, we want every clinical trial in the Americas to count. We want to see them considered, these clinical trials, in systematic reviews. We want equal opportunities to access registration in this region. We want a researcher in Honduras, El Salvador, Guatemala, or Belize to have the same opportunities to register as a researcher in the United States, Canada, Brazil, Cuba, or Argentina. We want to avoid duplication and work in the best spirit of Pan-Americanism, that spirit that has allowed us to join forces and to do great things, like eradicating polio, and more recently, rubella, or developing great resources like Viremi. We need to bring that spirit to work on trial registration, achieving efficiencies, sharing resources, and collaborating so that we can build efficiencies in our own processes and have the best possible standards and have from the outset data that can be shared and fed into the ICTRP database of the World Health Organization. We want to promote through clinical trial registration better governance of research for health. As frequently said, no data, no problem, no action. But with good clinical trial registration, we will be better suited to determine if research for health priorities are being cared for and what resources are available or invested in this type of research. This will allow a more strategic approach towards research and lead to action. And the returns of research will likely be more visible. Just to illustrate the potential benefits of having data, and you see some listed on the right, let me share with you two quick searches done in the ICTRP database. Oh, sorry, when I say on the right, it's on the left of this slide. I was able to quickly find out that there are 30 registered ongoing trials currently recruiting patients in Guatemala, and 35 clinical trials in kids in Chile recruiting participants. Let's just imagine that all that could be achieved in a if the database had could be achieved if the database had an accurate representation of clinical trials in the region that was publicly available. We could spend hours dreaming here, but the following three graphs may give you some insights into the opportunities that this would bring in terms of new knowledge generated. These maps are from the World Mapper and illustrate some data about scientific research. We will be able to get better data and more specific data about clinical trials on what is going on in the region and the world for clinical trial registration. Furthermore, data could be used to fit time series, like the one here on the right side of the slide. It was taken from Gapminder, a software solution led by Hans Rosling that offers a wealth of organized data that can be turned into graphs and time series. The image you see here, for example, represents the reduction of total fertility and mortality for kids under 5 years of age in the past 60 years. Graphs like this one have been fantastic, generating new knowledge and showing how we need to adjust our definitions and estimates. Other software pieces can illustrate interactions within networks. Just imagine the potential if we had data of researchers from the Americas and the impact this could have in addressing topics through multi-center studies, for example. You could quickly identify expert group networks and learn about how these work between them. But let's now come back to the reality, because we have some elements that are missing, and we need them to fulfill these dreams and opportunities. Despite all the experience accrued, the dialogue, the momentum, and the support gained, the reality is that currently non-English speaking researchers struggle to get the research registered. What seems an obvious instruction or requirement for an English speaker may appear as an insurmountable or discouraging requirement for a Spanish or Portuguese speaking researcher trying to register a proposal in existing databases. Some databases have high fees, and even though they may reduce them or even waive them from researchers from low and middle income countries, The fact is that a negotiation is required, and an explicit request has to be made, and this remains a problem and a barrier. We need an accessible register for non-English speaking people who want to register in a database that fits into the International Clinical Trial Register platform of the World Health Organization database. We need to get those working in setting up national registers to do it in coordination, sharing tools and standards. Our member states need help with information and indicators relevant to this issue, and key stakeholders need to be identified. Ultimately, we need a strategic approach that leads to accurate representation of clinical trials from the Americas in the International Clinical Trial Register platform. Hence, we need to figure out several things. Like, for example, the setting up of a functional advisory board or boards, the understanding of what countries in the region need. We need tools to address different needs in a way that promotes equal opportunities for clinical trial registration. And we need to find out resources to develop and maintain an accessible primary register for the region, especially when registers are servicing those most in need. That is why we call upon you today to help us brainstorm and come with ideas for a strategy that gets regional support, to provide your thoughtful recommendations for establishing a regional network that helps us define aims for the short, medium, and long term, and to advise us on choices for managing data and establishing sustainable processes. For example, we have dilemmas on whether data cleaning and translation to comply with the ICTRP standards should be done at the country level or centrally. Because one approach promotes appropriation, the other approach brings efficiencies and overall lower costs. We therefore seek your advice today to continue this journey on the correct path. So thank you so much for joining this brainstorming and consultation, and welcome to Washington, D.C.